Jennifer Gokenauer. I am the owner and main veterinarian at Living Springs Veterinary Care in Bennett, Colorado. I also have done a lot of work with both Adams and Arapahoe counties in the past. So you guys may have seen my face around at fair before. Those of you that know, I'm also a buyer. So be thinking about that too. Love supporting my 4-Hers, okay? So when Kinsey asked me if I wanted to do a little presentation for you guys about some healthy stuff for your critters, I said, heck yeah, sign me up. So here we go. We're signed up and we're gonna roll. This is the first of 3 series. I know you guys know that already, but I'm gonna throw a little plug in for my others. Today, we're gonna talk about sheep and goats. 2 weeks, we'll talk about the bovines, and 2 weeks after that, we'll talk about the porcines. So we got a lot of eins to talk about. Hang with me, come with me to all of these, and you'll be super experts. If you stay with me through all 3 of these series, you are going to very much see a trend. I'm going to be telling you a lot of the same things over and over again for a reason. So everything that you see that I've repeated myself or we talk about again, put that in your little brainiac skulls there. That's an important one, okay? All right, so it's a camelid, right? But let's not worry about the humps. Let's just assume these humps are down. So this is my sheep and or goat for the evening, okay? So we'll do a little props with my little friend here. I'm really bummed that you guys can't see all of my prop stuff. Let's see if I do this really quick. I've got a whole table of goodies that we're gonna show you here later on. So as we go through, we'll kind of talk about some of that stuff, okay? So it's kind of weird for me doing this, but we're gonna roll. We're gonna get this done. So here you go. You can all see my screen. Yes, thumbs up that you can see. It says Barnyard Basics, sheep and goats. Nice, nice, nice. Here we go. Maybe. I hit the button. There. Okay, it's coming. I'm gonna hit the button again. There we go. Caprines and ovines. So caprines are your goat species, okay? So caprine is anything goat related. Goats are very social animals. So they like to be in a herd. They are mainly raised for their meat, their milk, and their fiber. And if I had you at a class, I'd say like show of hands, who has a goat project? I'd like to see who's got goats going on. Oh, I got two out of 2 for you guys. Okay, so the 2 that I see are my goat people. I love that. Let's talk about goats. My ovines. Now, ovines are your sheep species. So anything and everything ovine is going to be sheep related. Sheep are also social animals, but they like to be in their flock. So we got a herd of goats and we got a flock of sheep, okay? Like a flock of geese. But sheep are raised mainly for their meat, their milk, and their wool, okay? A little bit different, a little bit the same. So we're gonna classify these guys as small ruminants, okay? You could also put your llamas, alpacas, and camelids in the small ruminants category, okay? Ruminant, let's just talk about that really quick. Ruminant, cow is a ruminant. Anything that has a rumen is a ruminant. That's how they process their food. Their rumen is a big fermentation vat and it breaks down a lot of food. We're going to talk about that rumen later. There's really important things to keep that rumen nice and healthy. So a ruminant is anything with a rumen. You can also, some people will say they have 4 stomachs. Now be careful with that. They do not have FOUR stomachs. They have FORE stomachs, very different. So we'll talk a little bit about that too, but that's what we're going to classify our small ruminants, our caprines, and our ovines. A lot of similarities with these guys when it comes to their basic health requirements, some of the disease processes. Some things are very, very different and special. We'll talk about that too. So let's kind of get down to the meat here. Know your norms. Know your norms. So when you hear me say this for like the next 6 weeks, okay, really important. If you know what normal looks like for your animal or your flock or your herd, okay, if you know what normal looks like and you understand that for your animal, then it's going to be very easy for you to know what early disease processes look like or early signs of sickness, okay? So here's some normal stuff. And if you guys have a pen and paper, you might ought to be jotting a few of these things down. Otherwise, if you need this, Kenzie or I can get you a copy of this at any point in time as well. So our normal temperature is 102.3, give or take a degree. Okay, so we're going to give a little fudge factor there, but that's kind of your normal range. Okay, pulse heart rate is between 70 to 80 beats per minute. Now, I cheat. The way I do that is I count for, you can do two things. You can count for 6 minutes and multiply by 4. That's an easy way. Or you can count for 4 seconds. Geez, count for, hang on. My brain is all backwards here. Okay, count for, probably the easiest way for you guys is going to be count for 6 seconds and add a 0. And that's going to get you beats per minute. So count for 6 seconds, add a 0, that's beats per minute. Respiratory rate, how many breaths per minute? That's 12 to 34 breaths per minute. Okay, that one, same deal, just count for about 6 seconds, put a 0 on it. Observe the diet, observe the ins and the outs. And that is what's going in and what's coming out. So what's going in is how much food we're eating, how much food, how well are they chewing, how well are they burping, how well are they doing their normal stuff, okay? Drinking water, are they drinking kind of the average amount of water per day? And then what's going out, notice their urine output, notice any weird colors of their urine, weird smells of their urine, their fecal matter, their poo, right? You really got to look at their poo. You got to see what color it is, what the consistency is. You guys should know that your goats and your sheep have these little pellets, right? Little raisinette poo pellets. That's what normal is. If you see something going softer or like a diarrhea, real watery, obviously that's a problem. Okay, so look at normals. Observe attitude, activity level, herd and flock behavior. So you guys know, especially goats, they're very, very curious. They're very loving. As soon as you bring out that feed bucket, man, they're on you like white on rice, right? So that's normal. If all of a sudden your goat is standing off in a corner and not coming to see you, that's not right. What's going on? If you have someone, a sheep, they like being in their flocks, right? So if you have a sheep that's hanging out normally in a flock, but then you have somebody standing off in the corner, that's not right. What's going on? If somebody's laying down for too long and they're not wanting to get up right away, what's going on with that? Okay. If you're milking, observe milk quality, the color of it. Consistency means you know what normal milk should look like. So all of a sudden, if it looks thicker than normal, there's probably not something quite right about that. Fiber and wool quality. Is your animal itching all of a sudden? Are they losing patches of fiber or wool? All of those are not normal things. Body shape, again, really important. Know what normal looks like. If all of a sudden you see the left side of your animal is sticking out like a balloon, that's not normal, okay? So you're gonna hear me say this a lot. If you know what normal looks like and you understand normal for your animal, then when something's amiss, you're gonna be able to jump right on that, okay? Okay, the best way to prevent disease is to not let it happen in the first place. Pretty simple, right? So how do we do that? First thing we do that is by buying and raising healthy animals, okay? So maintain a clean herd. Make sure that if you're breeding your animals, you're breeding healthy animals. If you're buying animals, buy them from a healthy herd or healthy flock, okay? Start right there, keep it healthy from the beginning. Maintain proper health care. Vaccinate, deworm, trimming hooves, shearing these guys, okay? All the normal healthy stuff. If you're not trimming hooves on a normal basis, if you're not shearing at least once a year, you are going to have health problems. I can just about guarantee you that, okay? So do normal stuff. Most common cause of most sickness is poor management, okay? That means if your barn isn't clean, if you don't have good ventilation, if they're stressed out because you're not feeding them on a good regular basis, those are all going to be problems, okay? That they're going to be stressed out from that. We talked about this, watch for early signs of disease. Catching something early is a lot easier to deal with until it gets bad, and then you call the vet, and then it's like a train wreck, right? So decrease stress. A nice, comfortable, happy animal is more likely to stay healthy, okay? So if you decrease the stress, you'll have a healthier animal. The more stressed out an animal is now basically capable of catching diseases, catching illnesses, if that makes sense. So, and stress comes in a lot of different forms, okay? Stress is even trailering. If the first time you ever trailer your animal is to the fair, okay, your animal is going to be really stressed, and then he's not going to want to eat. He's going to not want to drink. He can get really sick, okay? So you should be trailering your animal just cause, so he's used to it, right? You should be teaching your animal how to stand, how to walk on the lead, how to be sheared, okay? All those things are not normal things right away. You want to get your animal used to normal stuff, okay? Because all those can be stressful things if they're not used to it. Okay, provide a safe environment. We're going to talk about being safe and sound on the farm. That's all about housing as well, okay? So you want to have a nice house. You want their house to be clean and dry. You want to be able to protect them from the elements. Now, from the elements, that's not only like rain and snow, that's wind, that's sun. All of those elements are not good. If they're getting pounded by the sun all the time, they're going to be really hot, and that's going to be a problem. Light-skinned animals can sunburn. They can get overheated, exhausted, those kind of things. The house must be clean and dry, okay? They want a place to bed down and sleep, a safe place to sleep, safe from, we'll talk about predators, but also safe from, you know, rain and snow pounding on them all the time. Good ventilation is really, really huge, okay? Because as you know, when they're hanging out in the barn, if you go in a barn that's not well ventilated and not clean, you can smell it, right? You know, it smells like really heavy ammonia. It smells like poo, okay? That's a place that's not clean and not well ventilated. Those animals are going to be more stressed and more susceptible to diseases, okay? Having a place to play and climb and explore. Look at this guy, right? Goats, you guys know my goat people, they're crazy acrobats, right? They're gymnasts. They want to be jumping and playing and doing things. So give them a place, a safe place to do that, okay? This is a great safe place. Look, we got a fun little ramp. We got a place to be. I think we got a ramp over here. We got a house up there. I mean, what more fun for this little guy? This little jungle gym, right? But secure, it's got to be secure, right? It's safe. We've got a post here. We got walls here. This guy's not going to get hurt when he's jumping and playing. We got fencing in the background, nice tall fencing, right? Because these guys are jumpers, okay? So we have nice tall fencing. Can you see it has little squares right there? So we can't get a head caught in that because the grass is always greener on the other side of the fence, right? So they'll try and get through. And I guarantee you, if there's a way to escape, they'll find it. They'll find all the little holes. They'll find all the broken wires and broken fences. The other thing too is this is a nice safe place to protect them from them getting out because they will want to explore and roam the neighbor's property, or predators, okay? The coyotes out there, unfortunately, the other people's dogs that are out and about. So fencing should keep them safe from themselves and safe from everything else, okay? Feeds and feeding. Let's talk about that. That's kind of fun. I really like PowerPoints. I like things popping and coming up at you. So as it's kind of doing its thing here, let's jump off the bat and talk about water, okay? Fresh, clean water. And in the wintertime, not freezing. So I want fresh, clean water at all times for these guys to drink. That's not frozen, okay? Hay and grazing. Did you know that they should be eating approximately 3% of their body weight in hay per day? Okay, so that's pounds. So whatever their weight is, 3% of that is pounds of hay per day that they should be eating. they can graze. Grazing is great. You guys know this. Your goats will eat anything and everything if allowed to. They'll climb up on the tree and get the leaves on the trees. They'll eat mom's flower beds. They'll eat everything, right? The problem with too much fresh green grass is that's really bad on the rumen. That changes the rumen acidity content and can cause bloating. So that's a big problem. So be careful with grazing too much fresh greens, especially in the springtime, okay? Realize daily requirements are going to change. Okay, babies are not going to eat the same amount of food as adults will, right? We know that. That seems obvious, but sometimes you have to say the obvious things. It's going to change with pregnancy. Okay, obviously, when mamas are making babies, their energy requirements are going to be different. They're going to need more energy to make that baby. Okay, when they're milking, lactating, when you're collecting their milk every day, their energy requirements, their feed requirements are going to change. They're going to need more feed because they're using a lot of their calories to make milk, okay? Changing or increasing feed too quickly can cause bloating. We talked about that. So if you change their feed, if you go from a hay to an alfalfa, if you add a grain really quick or a concentrate, if you change that too quickly, again, the rumen can't handle that and it can cause bloating and change that rumen acidity, okay? So a lot of people will keep some baking soda on hand. Anybody out there feeding baking soda or offering it? Yeah, I see a hand. I see two hands. Okay, cool. I only see two hands because I have two people on the screen. Kenzie, do you see more hands going up with that?
I actually can see less than you can because I've got you on speaker view, so I just see your wonderful face.
Oh, geez. Okay. All right. Good. So I hope a lot of hands went up. Anyhow, feeding loose free choice baking soda. This is kind of cool because animals are really smart and they'll sort of eat what their body needs to eat, as crazy as that sounds. So if you just keep a little tub up high, not on the ground, it'll get dirty and get wasted, but keep a little tub that they can eat baking soda. It really does help. Okay. We also talk about trace minerals and salt. So it comes in a loose, like a powder form, or it comes in a block form. Okay, the block should be over there. I have you guys, I see you over there. There's a block on the screen over there. So blocks are awesome, although they're kind of heavy and kind of cumbersome. So it's totally preference, personal preference if you want to do loose or if you want to do a block, doesn't matter. Just provide them some sort of salt and minerals, okay? Here is a super important one, like highlight, star, write this down. For my sheep people, be careful about copper in a sheep's diet. It does very bad things if it's too high. So do not feed a sheep a cattle product. We'll talk about that later, okay? So they have cattle blocks out there too. A goat can eat a cattle block just fine. A sheep, not so much. So make sure you just have sheep and goat blocks, okay? Now, here's another one. Thiamine. Thiamine, important for all small ruminants, especially goats. Goats seem to be a little more sensitive to that. Thiamine is in the diet and they need to have it in the diet. If they don't have enough thiamine, that causes a very severe disease. We'll talk about that later. Vaccinate, very important. We talked again about that keeping things safe and healthy to begin with. So keeping things safe and healthy on the upside is vaccinating. Okay, all kinds of different vaccines, but there's some really important ones we're going to hit on first. This first one is Clostridium perfringens type C and D. That is very important. It helps prevent enterotoxemia. We'll talk about enterotoxemia a little bit later, okay? Tetanus, usually these main ones, you can see this one, Barvax, C, D, and T. It has Clostridium C and D and tetanus in it. That's like the main meat and potatoes, right? That's the vaccine that everybody needs to do to keep everybody nice and safe. There's other ones in here. This one has a bunch of cool stuff in it. This one also prevents blackleg and some other things. But if you're just vaccinating the basics, here's your basics, okay? Rabies should be on this side of the screen over here somewhere that I can't see. So rabies is not one that everybody does. It's not considered a core vaccine, but it's out there and it's scary enough that I believe in an ounce of prevention, pound a cure. So I do recommend vaccinating for rabies as well, okay? Rabies is transmitted by skunks and by raccoons and by bats. We all know about that. But if your animal gets bit, it can be life-threatening. Okay. Chlamydia, I was noticing, hey, that picture is flipped. That's kind of cool. So if you guys can read backwards, you can see how it says chlamydia. So chlamydia is a problem that causes abortion in goats, and we'll talk about that as well. Okay. Now, location, location, location. Who remembers location of where to vaccinate? There-ish, okay, right there. So if you see on my screen, here's a big green, where'd my cursor go? Right there. Big green dot, right? That is the only place that I want you guys to vaccinate intramuscular in the muscle injections. Remember meat quality assurance, right? Intramuscular injections are only right here. Now, if I had a whole classroom of you, I would say, who can tell me why? And I would want all the hands to go up in the air that you can all tell me why, right? So I'm gonna have to do it for you. So who can tell me why? I can, Dr. G. Okay, why? So you do not want to ruin any pieces of good, valuable meat, right? So if you give a vaccine, just happens to create an abscess or a tissue reaction or something goes wrong, okay, then this piece of meat is not a really great quality piece of meat. So we can get rid of that if there's an abscess or a problem there. Much worse to have a nice big hunk of meat back there have a problem, right? So only vaccinate up here in the neck for intramuscular injections, okay? Neck, here, area, okay? So there's kind of a nice triangle. You guys know this, meat quality assurance kids. Here's the shoulder, right? Stay in front of the shoulder. Here's kind of the top line, stay under that. And there's this big, very important thing down here, right? That's actually the cervical spine and like the jugular vein, the carotid artery, really important things live here. So you want to be above that, below that, in front of that. You got a big, nice triangle you can use. Got a couple other colors here. This guy is the pectoralis. So I'd prefer you not use that, but if you have something little tiny that you have to do something in, you can use that. I prefer you not to, okay? This spot right here is really great for some injections that only go under the skin, called subcutaneous. So there are some things that we can do just under the skin that we don't need to get deep into the muscle for, okay? Great spot right there. There's a lot of really loose skin in that armpit, okay? All right, all kinds of stuff that you can have in your first aid kit. And look, I've got this stuff that you can't see on this table over here. I've got a thermometer, right? Thermometer, okay? Really important. My suggestion is you get a digital thermometer. It's really hard shaking those old ones down. I'm so old, right? We had mercury thermometers. We had to shake them down. You guys don't even know that. Digital thermometers. Do not use the cool fancy ones now that we're aiming at our heads, okay? That doesn't work in these guys. You have to go rectally, okay? Rectally in the bum, okay? Right under the tail. So digital rectal thermometers are best. Exam gloves, please use gloves, guys. I know we're all tough. We're all cowgirls and cowboys, right? We're all grew up on the farm, but some things are just gross, okay? And then you're gonna go kiss your mom afterwards. So wear gloves. Do that for me, okay? Saline. So everybody wants to wash wounds out with something, okay? We know way better now than we did even 3-4 years ago how to wash out wounds. Use saline. Write this down, okay? If you have a wound you want to wash out, this is the best way to wash out a wound. It cleans out the bad stuff and it saves the healthy good stuff, okay? When we're using products like betadine or hydrogen peroxide or Vetricin, okay, when we're using those things, that does kill the bad stuff. It also kills the good stuff. There are good tissues and good blood vessels that we want in these wounds, that we disturb them with the peroxides and the betadines and all that stuff, okay? So this recipe is really good. Store this in a mason jar, okay? If you make a bit of this, keep it on hand, keep it in a mason jar, you'll always have it to clean out wounds. After you boil it for 15 minutes, do me a favor, before you use it, let it cool. Yes, I have to tell you guys to let it cool after it boils, because someday I had a client, I had a horse that they said, you know, that saline stuff does not work on my horse's leg. What's wrong? It's just saline. How could it not work on your horse's leg? I put that on and he gets so mad and he bucks and he rears and he won't let me touch him with it. I'm like, what are you doing? I don't understand. Well, you told me to boil it and then I do this. I'm like, oh, hang on, ma'am, pull back the reins. So now I have learned that I tell everyone, after you make saline and boil it, let it cool and then put it on your animal to flush out wounds. Okay. All right, isopropyl alcohol, that's plain old rubbing alcohol. Now I just said don't use that, right? Why do I have that on there? I have it on there because that's what you want to clean your instruments with, okay? Peroxide is great to clean stuff with, but don't put that in a wound. Ever, ever, ever don't do that. That's just to clean other stuff. Sometimes when I'm in a major pinch, I will actually rub alcohol in my hands and get my hands a little clean. I don't have any wounds now at this point in time. So I'll put alcohol on my hands and then I can do something if I'm out of gloves and I'm kind of in a pinch. So alcohol is great to clean things, not wounds, okay? All kinds of bandage materials, gauze and cotton balls and vet wrap. I've got gauze and I've got vet wrap and I've got elasticon. I got all kinds of fun stuff here, okay? And then my nurses today are setting up my prop table for me and they said, Dr. G, you forgot the most important part of bandage material in a first aid kit. Duct tape. Don't leave home without duct tape. Duct tape covers, you could be like, I'll age myself for the parents out there. Only needs a paper clip and duct tape and you can MacGyver anything, right? Okay, needles and syringes of all different forms and flavors. I clearly had my little guy here that I'm showing you. This is a little tiny guy. This is like a vaccine syringe, okay, or a vitamin injection if you need to. But if you need bigger ones like this dosing syringe, if you're doing things orally, okay. Stethoscopes are awesome. Unfortunately, with stethoscopes, you absolutely get what you pay for. And sometimes when you get really cheap stethoscopes, they're even hard to hear stuff with. So be careful with the stethoscope. Make sure that you get a good enough one that you can actually hear something with, okay? Antibiotic ointments, electrolyte powders. Okay, everyone wants to put something on a wound, right? We got to put something on the wound. Okay, I'm going to get so close. This is generic Walmart triple antibiotic ointment. If you must put something on a wound, you can use this, okay? Other great things, SSD is silver sulfadiazine, okay? Silver sulfadiazine, this is magic for burns, okay? Magic for burns, even a curling iron burn. Who's done that before on your forehead? I put that on my forehead. Yeah, see Lauren, she's like, I've done it. Yep. All right, sunburns. Who doesn't get sunburned, right? Live in Colorado. Silver sulfadiazine on a sunburn. Perfect. One thing that I didn't have on there, if you're in a major pinch, right, and you have nothing, but you want to put something on a fresh wound, you can put honey on it. Crazy, right? Be careful using that, but if you're in a giant pinch, you can use honey as you're getting your animals to the veterinarian. Okay, this is not an everyday thing. That's just a one time. I'm in a pinch. I got to do something. I got to get to the vet. You put some honey on, put a bandage on, get it to the vet, and then I'll fix it from there. Okay. Electrolyte powder. Good stuff. Keep this on hand because if you have somebody that's kind of pukey, not feeling really good, a baby with diarrhea, hydration. Keep them hydrated with electrolytes. Okay. Good stuff. Don't use Gatorade, please. Gatorade has way too much sugar in it. If you have to use something that you don't have that, you can use Pedialyte, not Pediasure, Pedialyte, but I would be much happier if you just kept a bag of this in your first aid kit, okay? Let's see, TheraBloat, I'm going on my list here. Please keep that, have one of those, just do it. It'll make everybody's life easier, okay? So have one of those and then use this dosing syringe if you need to. This is really great for bloating. We'll talk about bloating, but TheraBloat is going to help the bloating. We'll discuss how in a few more slides, okay? Blood stop powder, if you are trimming hooves, especially if you trim a hoof too short and you get a little bleeder, you can, if you don't have any blood stop powder in a pinch, you can use cornstarch, okay? So these are kind of in a pinch things and really great things. So keep your first aid kit handy. Now, here we go. I'm gonna get a drink of water because now we're getting to the meat of this thing. Most of these issues we're gonna talk about are good for, are bad for sheep and goats. There are some that are more prevalent in one or the other. We'll talk about those, but here we go. Abscesses, okay? Abscesses are most commonly caused by this bacteria called Caseus lymphadenitis. So that's an abscess, that's an abscess. This guy is just full of them. This is, I've tried to pick you guys the worst pictures that I could find. So if you're grossed out by them, just kind of we'll push past it. But these are abscesses caused by this bacteria. CL is what you may have heard of them, CL abscesses. These are bad dudes because they are very hard to control. They are very, very contagious. So if you see this, step one, get your goat away from everybody else. Get it out of there, okay? Because if these abscesses rupture, or if I have to come in there and lance it and drain it open, then that pus that's in there is full of bacteria and very, very contagious to everybody else. It's so bad that the dirt that it is on, I tell people, get bleach and bleach the dirt or scoop out a chunk of the dirt, because if this pus touches anything, if this pus touches halters or brushes, or if you're not wearing gloves, okay, and somebody else from the herd comes to sniff at the area, they can now catch it, okay? So super nasty. It is hard to control once an animal gets it. We do have blood tests for this even, because if you have an animal in the herd that has a problem with this, we may discuss getting that animal out of the herd, having that as a cull animal, okay? And not keeping that in the herd because it'll be really hard to control. Kinsey, if you have anybody that has any serious questions on any of these individual topics, if they're not writing them down, if you've got somebody that's just like, hey, get my attention, go ahead and interrupt me. We can discuss that because some of these are kind of important. Bloat, we talked about bloat. Okay, know what normal looks like for your animal, all right? This should not be normal for your animal, okay? I don't think this one's pregnant, but even pregnant, you can clearly see this animal on the left side of its body has a problem, okay? Bloat. Bloating is very simply excess gas buildup in the rumen, okay? It is 100% caused by diet issues. So if we have a rumen that's too acidic and the little bugs in there can't do their job and they can't ferment well, we're gonna have excess gas in there. Now, this is a good point. I made my daughter sit through this presentation last night and she said, well, Mom, can't you just squish that right there and out the gas comes? If it were only that easy, right? Problem with that, sometimes this gas is not just a bubble of gas, right? It's more a foam, it's more a bubble bath, okay? It's more a sink full of dish soap with bubbles. It's bubbly. That's called frothy bloat. Now, if it's frothy bloat, they can't burp that out, okay? That froth gets stuck and it doesn't come out. So we use TheraBloat, okay? TheraBloat to the rescue. TheraBloat is a surfactant product, okay? A surfactant means that it's gonna take all those little bubble frothies and it's gonna make it one big bubble. And once you have one big bubble, then your animal can very easily or more easily burp that out, okay? So, but if it's too bad, now you guys, this can get so bad. I have seen animals die, okay? Reason being is this rumen is so big, it's putting pressure everywhere, right? It's putting pressure on what lives right here, which is the diaphragm. Okay, pressure on the diaphragm puts pressure on the lungs. They can't breathe as well as they should. Okay, if they can't breathe, they die. Okay, the other problem is there's something that lies right along the top line here. Big, big blood vessels, the aorta, the caudal vena cava, big things with big names. And when this rumen presses so much on that, they can actually not get enough blood flow to the rest of their body as well. So this can absolutely be life-threatening. So little bit of bloat, know what normal looks like, right? So you can catch things early. If you catch your animal a little bit bloated and you give them TheraBloat, yay, you've solved the day. But if you don't catch it or you don't see it or it's really, really bad, you need to call the vet out right away because I don't want your animal to die. This is very treatable still, okay?
We do have just 2 quick questions on the bloat before
Yeah.
we move on. There's some other questions before, but we can get those at the end. Lauren is wanting to clarify, is the TheraBloat a vaccine or is it just something you give
Yeah,
in
good
response?
question. This is not a vaccine. This is a treatment, not a preventative. Okay, vaccines prevent disease. This is a treatment. So this little guy's a little 2-ounce bottle. I usually mix this with about a gallon or so of water. And then way I do it, I cheat and I stick a tube down their throat and I put it right in a funnel in a tube right into their rumen. Okay, you can use a dosing syringe to get that down. Basically, this has to get down into the rumen. So it's to treat bloat, not to prevent bloat.
And then we did have, Jamie just asked where you can get TheraBloat.
From me, from your veterinarian. I do not know if this is like a Murdoxy type thing or a Big R type thing. I honestly don't know. But anybody that wants to come purchase it over the counter from our vet shop gets it for sure.
Perfect. And then the last one that we've got bloat is Morgan's asking, would they be coughing a lot?
No, actually, they don't. What the first sign you're going to see is definitely this kind of swelling change in body shape on the left side. The next thing, they might grind their teeth. So teeth grinding is certainly a sign of discomfort in these animals. So grinding teeth is not good. Sometimes kind of real fidgety. This is like the goat version of horse colic. Okay, so this is when you feel a rumbly in your tumbly, that's not going to be good. And you're like, oh, my tummy hurts. This is pain. Okay. So not coughing, but a pain response.
All right. And then we got 2 more that popped in. Lene's wondering, will they lay down all day if they're suffering from bloat?
Yeah, they sure can because they hurt. Again, that's pain. So they're gonna go away from the herd. They're gonna lay down. You're gonna see responses that are definitely not normal. For sure, like a pain look.
And then Alyssa's wondering, and I'm assuming this is on the bottle of TheraBloat for directions of how to give it, but she's wondering, do you give the whole gallon of water mixed with the TheraBloat?
Yeah. So whole bottle of TheraBloat to about a gallon. Like they does it. Let's see. I haven't read the directions on this in a very long time because I just do. Do. Yeah. So the directions tell you to use a stomach tube, which you guys aren't going to do. So yeah. If you're going to use it as a drench, they do have as a drench to use this whole. Yeah, no, don't read the label. That's more confusing. So I put that in a gallon, but you don't have to give the whole gallon of water. That's kind of a lot of water, especially if you have like a little pygmy goat or somebody. But you're going to mix one of those whole guys in a gallon of water. And I can't tell you like exactly how much to give. It's sort of an eyeball amount. I mean, if you have a pygmy goat, I mean, if you get half a liter or so into that kid, that will definitely help as well. Okay. So label instructions aren't great. But you know, if you have a good healthy Nubian that can take a half gallon of water, you can do that too.
Great. And then, all right, this is going to be, I think this is going to be our last 2. Jamie's asking on bloat, does it typically only present on the left side?
Okay, great question. Yeah, so that's anatomy of the small ruminants. So yes, the rumen is on the left side of the animal. So for sure, that's a great question. Yes, it is absolutely. Where's my cursor? Right here. Left side, because that's where the rumen lives. So rumen lives on the left side.
Perfect. All right. And then I'm just going to give a little precursor here, you guys. You guys have a lot of great questions. This is why we always tell you guys that you need to get set up with a vet and have that vet client patient relationship. So that if your vet, you do get these medicines from them, you can give your vet a call and ask some of these clarifying questions, because they've already seen your herd and they might not necessarily have to come out. They can clarify some of this. So Lauren's question is, should the gallon of water be lukewarm or hot or cold? Does it matter?
It does matter going into your animal, right? So assume again, what kind of water temperature would you want when you had a tummy ache? Okay. You don't want it really hot, don't want it really cold. So kind of a nice room temperature water would be really great.
Perfect. And then very last one, is, does the weight change the amount of the TheraBloat, the weight of your animal change the amount that you're giving them?
Yeah, it does. Again, your pygmies, your dwarfs are not going to be able to have as much volume as your big Nubians or boars.
Perfect. I think that's what we got on bloat so far. So
all right, let's roll on.
Thank you.
Chlamydiosis, that's that vaccine we talked about earlier. So it's a virus that causes abortions. Okay, here is a word that we all need to learn. Word of the night. Okay, zoonotic. Zoonotic means something that animals can get and humans can get. So chlamydia is zoonotic, meaning if you have an animal that has an abortion, let's just assume we don't know if it's chlamydia or not. Always assume it is, okay? So wear gloves to touch any of the tissues, the aborted fetus, any of the placenta. Wear gloves because you don't want to be touching any of the infected tissues because you don't want to have this disease, okay? And it's, again, extremely contagious. So any other animals, you don't want them touching this either. So really important. If you have an abortion, especially an abortion storm where a lot of animals are aborting, you definitely need to call your veterinarian right away. But vaccine is good to prevent this, okay? Coccidiosis. Here is a good one that I see a lot of. Talk about stress, right? So coccidiosis it's a normal protozoa. It's around, it's in the area, but hygiene will control this. Again, clean area, clean bedding, clean houses, clean food bowls, clean water bowls, keep things clean, okay? When they have coccidia, their diarrhea can actually look red. They can have a they can have a red diarrhea. They can have weight loss. They look really sick. They look really bad. Okay. So what I'm going to have you do is I'm going to have you clean, get that animal away from any healthy animal. So isolation is really important. And then bring me in a fecal sample, bring me a stool sample. We'll see if it has these little dudes hanging out. Where's my cursor? If this is hanging out in the stool sample, we're going to give you Corid, which is a sulfa. That's going to clear that up for you. Okay. Enterotoxemia, we talked about this. That is the vaccine. That's the C and D. Okay. So prevents Clostridial infection. Clostridial infection is going to be in the abdomen, in the intestines, in the stomach. That is a bacteria that causes a lot of gas. So a lot of gas is how you're, again, going to get a swollen stomach. That gas is really painful. So you're going to have a lot of, again, that teeth grinding, that painful response. They will have a fever. This is an infection. Okay. Again, I have seen this cause death in not only sheep and goats, but also in cattle as well. So it mainly happens to the young ones, to the babies. It can happen to everybody. It's worse in babies. So watch this: swollen stomach, fever, teeth. Definitely vaccinate. A lot of these you're going to see is call a vet, call a vet, call a vet. There's so much you can do at home, but when things get bad, call the vet. Okay. Foot rot or hoof rot. This is hygiene. You should be clipping these hooves, trimming these hooves on a regular basis. Okay. It's going to cause lameness. It's going to be stinky, smelly feet, stinky, smelly toes in between this interdigital space right there in the claws, around the claws. This obviously is a yucky case of it, but very easy to treat, very easy. Trim up these hooves. This is where you use betadine. Okay, this is betadine. We're not treating a wound per se, but we've got a nasty bacterial infection we have to clean out of there. So you can use betadine on that. So again, this is hygiene. This is not walking around in wet, yucky ground. Okay, this is walking around in clean ground and clean shaving. So very preventable, very treatable. Ketosis is pregnancy toxemia. This, again, we talked about as their bodies change, so do their dietary needs, okay? So this is metabolic, meaning a dietary problem in late pregnancy. So late pregnancy, she's gonna look really sick, sick dozed. She's gonna be in a corner. She's not gonna be wanting hanging out with everybody. She looks bad. She's looks like she's pouting. She's just off in a corner by herself. She looks very sleepy. Okay. Some people will have propylene glycol on hand to use as a drench to give them kind of right away to kind of correct that metabolic state that she's in. She's in a very bad metabolic position. So this is preventable by proper feeding, especially in that late gestation. Treatable with propylene glycol at home, or if it's too bad, looky there, call a vet. Lice, louse, keds. They're called mainly keds in sheep, mainly lice in goats. This is an external parasite. Here's a word for you, ectoparasite. Ectoparasite means external, so on the outside of the body parasites. This is a white-haired goat, kind of cheating because you can see these little orange to brown dots. Totally cheating because you really cannot see these with the naked eye. You gotta, so when I see one, you gotta look really, really close, like you gotta look really, really close, right? And separate out the hair. Some of your dark-haired animals, it'll look like white, like dandruff sometimes. They're really, really itchy, crazy itchy. A lot of hair loss associated with that. So when you got really itchy animals that are losing hair, you can kind of separate the hair and look really, really close and see it's not going to look like this. This is magnified lots and lots and lots to show you how gross he is. This is kind of a cool picture, but you're barely going to see some little bitty salt grain thing moving. And when it moves, it's lice, okay? Very preventable. Powders and dips and sprays with pyrethrin or pyrethroids. This definitely is an over-the-counter thing. For sure, there's different ingredients at your Murdoch's, at your Big R, at your feed stores that'll carry these for you, okay? Mastitis. This is an infection of the udder. Mastitis happens inside the udder where the milk is being held. Okay, this is a bacterial infection. You're going to see a very swollen udder. It's going to be very hot. It's going to be very painful to her. Okay, painful to you when she kicks you because it hurts her quite a bit too, right? So this is a really bad one. Can't really see this too well. This one actually ruptured out the udder, and the infection is coming out the outside. It got so bad it went all the way through, and there's an abscess on her udder. Okay, this, here we go, good hygiene. Hygiene fixes so many things. Okay, bad hygiene causes things, good hygiene fixes things. Think about this. When you are milking, okay, the udder and the teat are open because milk comes out. Anything that comes out of the body has a hole that can go in the body. So if you're milking, milk comes out, bacteria can go in just as easy, okay? So when you're milking, you got to keep these udders nice and clean. So you should be washing these udders before you milk. You should be washing udders after you milk also as well. Keep those udders nice and healthy. Bacteria gets up in there. That milk is a great nutrition source. It's warm. Bacteria go explosion crazy, okay? This is one I'm going to have you look for, again, that discolored milk. If milk looks a little bit thicker, this is back to know your normals, okay? If the milk looks thick, if it has any weird color to it and not that nice white milk look, if it looks kind of yellowy, too thick. Oh, look, somebody's got a cat up there. That's cute. These Zoom things, you can see all your stuff at home. I love it. So know what normals are. If this does not look right, call a vet immediately, because this is very treatable when caught nice and early. Okay. This one is still treatable, but it makes me, my kids say I put my eyes down. That's when I'm mad. I put my eyes down. So I put my eyes down at you and say, why didn't you call me like last week? Okay, we could fix this. So nice and early. Please, 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 please do not consume the milk. Okay. Do not let anyone else consume the milk. Do not let the babies consume the milk. This milk needs to be poured out, okay, away, because it has a lot of bacteria in it and it will make somebody very, very sick, humans and animals alike. Orf. Orf is fun.
Dr. Dokenauer.
Yeah.
Sorry, we do have a couple that I just wanted to, we've got great questions coming in, but a couple on mastitis.
Yeah.
Kenna is asking, she has a doe that got mastitis 3 years ago. She's wondering if she can still breed her.
Good question. As long as the mastitis is cleared up, and 3 years ago, it really should be cleared up. If you haven't discussed that with your veterinarian, just make sure there are tests that we can do on very little amounts of milk to see if there's still bacteria in them. It's called the California mastitis test. It's super cool. I have this little tray that has circles in it, 4 circles. So these are for cows, so 4 quarters. And I put a little bit of milk into each tray. And then I put this super cool purple stuff in it, and it tells me if there's any bacteria in that milk, kind of a quick and dirty way to see. So you can breed her back. She will breed back just fine. You're still worried about her milk quality then for her baby as well. So she'll breed, but you want to make sure her milk is healthy for her baby.
Perfect. And then Morgan is wondering if you need to worry about mastitis for your meat goats, your does.
Yeah, so mastitis typically is only going to happen when they're milking. Okay, so it's going to happen in mama meat goats if you're breeding, but if you only have your one project animal and it's a meat quality or a meat project animal and you're not breeding it, shouldn't be a problem.
Perfect. I think those are the 2 I wanted to throw at you right there.
Cool. Okay, let's talk about Orf, baby. So Orf, that's really old. Only parents are going to get what I just did there. Maybe Kinsey, you're too young. All right. Sore mouth, contagious eczema, and contagious is a good part to remember on that. This is good news, self-limiting, okay? It should only be around 1 to 4 weeks. You'll have these blister-like sores that'll turn into these really crusty, nasty things, but it's really painful. So these animals are probably not going to want to eat and drink as well as they should. So you want to do supportive care. So keeping that area clean for them, making sure they're eating and drinking. Wear gloves, wear gloves. The other word on this is zoonotic, okay? So wear gloves, because I have seen humans that have gotten orf sores on their hands and they're gross and they hurt. And yes, it's self-limiting, like it'll go away on its own, but why even try? It's bad news. So this is very bad in a sense that it's really painful. You can have animals, once they hurt and they don't eat and they don't drink, then they get sick and then you got other issues. So it's bad in that sense, but it's good at that it is self-limiting. It should go away on its own. If it doesn't, call us and let us know. But supportive care, really important for these guys. Pink eye. Pink eye is bad, bad. Okay, it is infectious, so also contagious to other animals. The kicker with pink eye, I'm looking at my sheet because I don't see it on your screen. So there's a goat here with a bad eye, right? Picture right there. You guys see that? Thank you, Kinsey. So what happens is flies will rest here and eat on the tears that are coming out. So you have red eyes, you have watery eyes, they squint, they hurt. This is very painful, okay? Very painful. But the flies that are eating all the yucky stuff will then go to all the other animals in the herd and spread this all over the place. And it could be really bad really quickly. This eye isn't the worst. The worst is when they actually get ulcers or literally holes in the cornea of their eye, and that can cause blindness, okay? So again, this is something you have to catch this early, okay? All about hygiene. Keep the flies under control. Keep that eye nice and clean. Isolate this animal from the herd and call a veterinarian immediately. What we're gonna do is we're going to do several different treatments. My treatment of choice is, this sounds awful, but in the eyelid, I'll actually inject some penicillin in the eyelid, and then I'm gonna take the third eyelid and I'm gonna suture it closed. Sounds crazy, but I'm gonna suture this eye closed. It keeps that eye protected, okay, from dust and sun and yuck so it can heal. It's also gonna keep it from all of the other animals and flies messing with it, okay? A lot of treatments we can do very, very curable early, okay, before we cause blindness. Here's this one. I said we'd get here. This is bad news. This is polio, polioencephalomalacia. This is 100% dietary. It is from a thiamine deficiency in the feed. Now, thiamine deficiency can rear its ugly head unbeknownst to many people. I had a client feeding really good quality goat feed. It was a ranch way goat feed that they got at any other feed store. Should have been fine. Why did their animal have a thiamine deficiency? We dug into this feed and we found that inside the sunflower seeds, the black sunflower seeds had mold in them. Crazy, right? So the mold in the black sunflower seeds was destroying all the nutritionist content of that feed and causing a thiamine deficiency. So can be treated when caught early, okay? Caught early, know what normal is. This one is gonna be weird early. This one is, they're gonna look like they're blind, okay? They're gonna be like staggering around, like where are things, bumping into things, head pressing on walls because they don't know where they're at. So I'm just gonna stand here and wait, all the way to, this is polio. This guy is actually, it can cause seizures. So if we go from the blindness and the kind of drunken staggers to pressing my head to all the way down to seizing, when they go in seizure mode, it's really hard for me to get them back. I can and I have, but I'm sorry. I can get them back and I have got them back. It's just much harder when they're there. And I can't get the blindness back. Once they're blind, they're blind. I can't get that back. I can get you a healthy animal, but there's some things that even I can't fix. Crazy. Pneumonia. Okay, so basically pneumonia to any sort of respiratory disease. So there's upper respiratory diseases and upper respiratory disease, anything in the head. Okay, upper respiratory is up here. Lower respiratory is in the lungs. That's where pneumonia kicks in. So upper respiratory, sneezing, coughing, runny nose, runny eyes, those kind of things can be caused by viruses, bacteria, parasites, allergies, so many things, plethora of things. Eastern Colorado, welcome to the Dust Bowl. Okay, that can cause upper respiratory infections. They're easy to treat early. When it goes down into the lower airways, and when we actually have a lower airway disease or pneumonia, that's harder to fix. Yes, I can fix it, but that's hard. So call me when it's early and we'll help, we'll fix it. Ringworm, okay? Here in a sheep that's been sheared, here in a goat. Ringworm, even though it says worm, it's not a worm, it's actually a fungus. There's a fungus among us, dermatophytosis, okay, cool big words. So this is a fungal skin disease. It is called ringworm because you will pretty much see these classic round sorts of problems in the skin. So round hair loss, sometimes kind of scabby, sometimes kind of crusty, sometimes the skin looks kind of red. This one is ringworm. This, you can't even see the skin because you've got this patch of round crusties on it, okay? This guy is not wearing gloves. Bad, okay? Wear gloves. This one should also say zoonotic on it, means this can be transmitted to this. Maybe it is right there. Ha, interesting. Anyhow, I have had ringworm. Got it from a cat. Okay, cats are really bad for it. So it is treatable. Okay, don't touch it with your bare hands. This is one you can use betadine on as well. Okay, you can use betadine. This one, betadine will kill this fungus. Call me if it's too bad. Okay, clean the area. Oh, this is hygiene. Okay, the hygiene too. So keep your area clean and isolate. Isolate this animal, good hygiene, clean it up. Okay, call it that.
Goknar, can I just pop
Yeah.
in just
Yeah.
to give a little piece for our 4-H agents, you guys? So a couple of these, especially these zoonotic diseases that she has mentioned, a lot of common ones we see are ringworm, especially in the spring when it's time to tag these animals, because it's a little wetter outside and everything. If you guys have tag-ins for your market animals, and you notice that one of your animals has ringworm, or heaven forbid has sore mouth, please contact your 4-H agent and let them know ahead of time so they can schedule you either at the end of the tag in so that they can wear gloves and take precautions, or they can make sure to clean the scale after you pass through. So it's just a common courtesy, you guys. Obviously, when it comes to fair time, this is what vet checks are for, and animals with these will not be admitted because we don't want to pass those things. But at common courtesy at the tag-ins, please let your extension agents know if you think they might have that, and they'll let you know how to proceed. Sorry, just had to put that in there.
No, I'm glad because I have caught not a lot, thank goodness, but I've caught some ringworm at time of fair check-in, and it makes me be the bad guy, and I don't like being the bad guy. So when I catch these, I have to be like, you know, you're here, it's fair time, ready to show, because this does not affect the meat quality of the meat quality animals, but it's contagious. And I've got people in the fair, and I've got kids that won't keep their hands off of everything in the fair, right? So I got to be the bad guy, and then you're going to cry, and then your mom's going to get mad at me. And so it goes on and on in a circle. So try really, really hard to take care of these early. Scours. Scours is kind of the fancy word for diarrhea. This, where's my cursor? There it is. So sometimes this will be like a mustardy, pasty yellow. It's nasty. It stinks. It's sticky, nasty stuff. Happens again a lot more in my baby animals. Can happen in everybody, but happens a lot in baby animals because they don't have all the immune system that the older ones have. So baby animals that are eating things that aren't quite right or don't quite have the colostrum that mom gave them yet can scour very easily. It is normally very easy to treat if caught early. Okay, if caught early, we can treat this. Here's hygiene. Okay, get these guys away from everybody else because it is nasty. Okay, and sometimes the bacteria in this can be contagious to everybody else if somebody sticks their nose in that. Because animals are animals, right? Somebody's going to stick their nose in that. So in the babies, make sure they're hydrated, make sure they're eating. They need milk. This is where our electrolytes come into play. Okay, keep them well hydrated, and we can work them through that. If it's too bad, call a vet. Urinary stones, bladder stones, kidney stones. Worse in boys than it is in girls. Reason being is boys pee out their penis, girls pee out their kind of near their vagina area, vulva area. The urethra is the actual tube that urine comes out of. The boy tube is smaller than the girl tube. Okay, that's the easiest way to put that. So sometimes little stones, girls can pee them out easier because their tube is a little bigger, but boys, their tube is a little smaller. So smaller stones get caught up in boys. And this is really bad, like really bad, because urine is supposed to be out, not stuck in. So this makes urine be stuck inside. So where's my cursor? There it is. So difficulty urinating, okay? Painful abdomen. This is where know the ins and the outs, right? Know when your guys are peeing and how much they're peeing. Look at that, notice that. Painful abdomen. So again, this can be teeth grinding. This can be going off into a corner. This is painful response, definitely caused by diet, okay? Not the right quality of minerals, definitely not drinking enough water. So not being well hydrated will be worse and cause these. They can get bad enough that it may require surgery, okay? So easy to treat with the right diet and right hydration. Catch it early. Some boys, I can just work on getting it out of their penis. Sometimes they're just stuck right at the tip of the penis, and I can deal with that pretty easily. So figure it out early, know what the ins and outs are, okay? Worms. We talked about ectoparasites being parasites on the outside. Worms are endoparasites, parasites on the inside. So, and this is just a snapshot of eggs of different parasites. You will not see these, okay? This is what I see when you bring me a poop sample and we look at it under a microscope. So these are microscopic different kinds of eggs. So make sure that you're deworming your animals. I like deworming once a year, no matter what, okay? If you're keeping your breeding animals or your pet animals. So deworm once a year when you vaccinate. If you're not sure, but if you're seeing weight loss, poor coat, this pale eyes, that's because some of these parasites are all eating the nutrients that your animal is taking in. So your animal is not getting the vitamins and nutrients that it needs, calories it needs. But they can also cause problems with red blood cells, and they cause what's called anemia. So if your animal's anemic, you're going to see pale eyes. Okay. So deworming for just the basic ivermectin is a great dewormer, but let's say that's not getting the job done. You got to bring in a stool sample and we'll figure out which one of these bad guys it is and treat for that. Okay. Wounds. Wounds could be 1,000, million, 100 different things, right? So anything from getting kicked by a buddy to getting cut, from curiosity not being where they're supposed to be, and that's why we need that nice safe shelter for them, right? So any kind of external injury from any kind of trauma. So I talked about everyone wants to put something on a wound. That's great. Clean the wound, cleaned all those wounds, clean them with saline, okay? And if they're superficial, put some of that Neosporin or my generic triple antibiotic on there, okay? Saline and triple on nice minor things if you can handle pretty superficial. If it's any deeper than skin thickness, like if you can peel skin away, you need to call a vet. Okay, not good. If it's just a scrape or a scratch, you know what that looks like. You can treat that at home if you want to try that yourself. But anything through the skin, definitely call a vet. I did not put on here, but also like leg injuries, major lamenesses, if an animal's not putting weight on all of one leg, if you're concerned that if a kick was bad enough to actually cause a fracture, okay? What I didn't throw in here, we'll talk about. If you have, this guy's almost too small, okay? If we have a bad leg that's injured, you can use either PVC pipe or you can use pieces of wood, gauge it to the size of your animal. Okay, a 2x4 on a pygmy goat's probably not going to work so well. So a 1x4 maybe. So make sure that you put a splint 90 degrees, a splint on the outside and a splint on the back, outside and back. If you can splint those two spots of your animal's leg and use your duct tape, right? Cures all evils. So 1x4 PVC, 90-degree angles on the leg. PVC is great because it'll cup that whole leg all the way around it. So cut PVC pipe in half. So you have kind of a U cup shaped PVC pipe, stick it on the leg, duct tape that sucker on there, and then get it to me right away. Okay, that's a great thing for a really bad leg. All right, let's talk about some things that are kind of more common in some of the other. So caprine arthritis encephalitis, CAE, you've probably heard of that. This is really bad, okay? This causes death in the babies because babies get it from moms while they're being cooked, okay? In the adults, you may only see these swollen knees. This is the arthritis part of this, caprine arthritis. So that's what the adults get. When babies are born, they get the encephalitis portion. That's a problem in their head, in their brain. Okay, that's why they don't live, because the infection is in their brain. So these babies don't make it. Sometimes they will be aborted. If they make it to term and they're delivered, they won't make it. These babies will die. Okay, this is really bad. How do we fix this? Is having a CAE-free farm. So again, that's keeping our breeding animals healthy. That's buying animals from a CAE-free farm. We do have tests for this to see if we have CAE in the herd. There is no cure for this, guys. This is one of those really bad ones. Okay, so we'd rather prevent that because we can't treat it. Okay, some more specific sheep ones. We talked about copper in sheep, okay? Excess copper causes liver damage in sheep. The liver doesn't know what to do with too much copper in a sheep. So it builds it up and it stores it, and it stores it so much that then the liver can't do its job for regular purposes, okay? So then you got liver problems, and the animal can die because of copper toxicity. This is why we don't feed horse, cow, pig, anything to sheep, because they will have too much copper in them. So only sheep and goat stuff to sheep, okay? Johne's disease. Yes, it does look like John's disease, but it's called Johne's disease, paratuberculosis. This is fatal. This is another in the stomach one, in the stomach, in the intestines. It does cause contagious bacterial gastroenteritis. It seems to be worse in sheep from what I see. It does, all ruminants can have this, so goats can have it, but sheep, it seems more prevalent. This is a bad deal. They don't make it from this, okay? There's really no great way to prevent this, but again, keeping healthy animals, start healthy animals, keep healthy animals. That's how we can deal with that. Scrapies, again, these are bad ones. I'm sorry, I'm giving you all the bad ones, right? The scrapies is also fatal. So again, this is more of a prevent it than try to treat it, because there's no treatment. So the prevention is, again, that scrapie-free herd or scrapie-free flock. This is why USDA has their scrapie ear tags, and you have scrapie numbers on your premises. If you're continuing to breed, you have a breeding farm going on, you're going to have a scrapies USDA tag to put in their ear, okay? This one's fun. I love this one. This one makes me look like a hero when I get it. So plugged toe glands right in the middle of a sheep foot. There, this is so obvious. This one makes me look like a hero because these guys are really sore. They hurt. They walk like they're walking on eggshells. Maybe just one foot, maybe a back foot, maybe whatever, but they hurt really bad, like to the point of people think their sheep's leg is broken. But this little guy is a scent gland, believe it or not. It makes them smell yummy to other friends, or not so yummy to humans. So this guy is like a zit. So it's there on purpose. It's there to make smell, to make stink, but it fills up with too much stinky smell. It fills up with dirt. It fills up with hair. It fills up with goo, okay, for the best way to put that. And literally to fix this problem is you pop this sucker like as big as zit you've ever seen, and you clean it all up, and then you look like you're like the hero of the sheep world. Super easy, okay? So let me check my notes before I push on to your notes. Okay, so we're kind of done with the big bad uglies. So let's go on to something kind of fun. And after we do something kind of fun, then we'll take some more questions, okay? So here's something fun. Fun facts. Did you know that based on the Smithsonian Institute, there are about 200 breeds of domestic goats? I don't even know that. I had to learn that. Pretty cool. 200 breeds of domestic goats. We're not even talking like the wild ones, okay? Or the ones in other areas. So it's also believed that there are more than 1,000, that's right, 1,000 domestic sheep breeds. We're not talking the wild guys. We're not talking the rams. We're, go CSU. Okay, there you have it. Yeah, we're talking 1,000 domestic sheep breeds. The only thing that there's more than 1,000 breeds of, guesses, chickens, poultry. Poultry has more than that, but that's it. Goats and sheep are both herbivores. Okay, herbivores means they eat grass. So all of their teeth that they have, all of their molars are meant to grind grass. They don't have teeth on the top, right? They have a dental pad. So when they bite you, it only hurts a little bit. not a lot of it, like when a dog bites you. Okay, so they eat grass. They're made to eat grass, and they're ruminants. We talked about that rumen, right? They have a rumen. They are a ruminant. Goats have 60 chromosomes. Sheep have 54 chromosomes. Humans, FYI, have 46. So now who's the better of the species, right? Okay, goats' tails usually point up. You see a goat flagging its tail up there, right? And sheepy tails usually hang down. Sheep don't have tails that go up. Actually, if you know and you're docking your sheep tails, they go way down, right? Mostly they're docked. Reason for docking is hygiene. Hygiene. We dock sheep tails because of all that wool that they have. If they have that hangy down tail, where's my little dude? If they have this hangy down tail, a lot of poo collects here and can get really dirty on the wool. So it's just a hygiene thing. I mean, yeah, it's kind of sad that we got to cut those cute little tails off, but it keeps them a lot healthier and a lot safer. Trying to breed when they have big, nasty wool and poo on their tails is really hard to do. Let's see where we at. Horns. Most goats have horns. That's why we debud them when they're little bitties. And as you know, with 4-H, you will not be allowed to show with horns. So please, 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 the phone call I get when it's like 2 weeks from fair and you didn't have your guys debudded, and then I have to go away to not be the bad guy and say, you can't do this. Okay. It is so much easier to debud them than to dehorn them. Dehorning is a major process that we don't want to deal with. Okay, so debud them early. But many domestic sheep don't have horns. And we're saying domestic sheep. So yes, I know, go CSU Rams, big curly, right? So goats. Goats are herd animals, but will also be very independent and curious. You know that they like to play and jump and run and do things, but they are sticking to their herd. But sheep like to flock. Okay, sheep are not as independent and crazy as goats are. There you go. That's what I got for you guys. So there's my pun for the night. I was so proud of myself when I thought of that one. And my whole family went, really, Mom? And I went, rock star. So I am now here for you.
Awesome. Thank you very much. That was awesome. We do have a good number of questions. I think if you're okay with it, maybe we'll take them for 5-ish minutes and try to wrap up here around 7:30 or so, but we do have some good questions. I will say for the most part, you guys, just as she just mentioned, the dehorning of animals and everything to show at fair, make sure you're checking your fair's rules, especially when you're getting your animals, because different fairs do have different rules. Some do allow them, like meat goats, to show with horns if they are tipped or taped for safety. Some do not. So that's something to just really be aware of for which shows you are showing at. So you're not caught with a goat with horns that you're not able to show. So let's see here. I think what I'm going to do is I'm going to kind of go back to the.
We can do like lightning round too. So we can do like short, sweet lightning round questions.
Perfect. That's back to the top. We had some when we were feeding and watering. So Monica had, what is the average amount of water per day for a goat?
That is a great question. Average water per goat. I know it's 10 gallons in a horse. That I don't know, but you know what? I'm going to find that out right now for you, because I have a special thing. It's also going to be a little different because there's so many different breeds. So again, your Nubians versus your Boers, that's going to be really different. We don't have like an average amount. Your average size goat is going to drink 2 to 3 gallons of water per day. So that's average. So obviously your Pygmies Nubians not going to have that much, but 2 to 3 gallons a day for an average goat.
Perfect. And then Lauren was asking if you use feed. I'm assuming she's talking about concentrated feed, since that's what a lot of our market kids feed. Yep. How much should they have? Because you talked about 3% on the hay.
3% on hay, and you're going to go with about 10% of that, so smaller on your concentrates.
All right, perfect. Morgan had a question. What kind of bandages do you prefer to use on goats?
So kind of depends on the wound. I really like, this is a white cotton, like gauzy thing. So it's really easy to use. It's on the roll, so it's super easy. It's called cast padding. This stuff is great. Once I find it, this is vet wrap. So vet wrap is super awesome because it sticks to itself. Okay, sticks to itself, so it's easy to use. It won't stick to the animal, but it sticks to itself. Problem being, sometimes that slips on and off the leg. So that's where I use Elasticon. Elasticon is really sticky and it'll stick to the hair. So it'll stick to everything. So don't put this like on the wound because it'll stick to the wound. So you want to put something soft like a pad, a Telfa pad, and then you can put this on and wrap it up like that.
Perfect. This one might not be a lightning question, but Kenna has a couple breeding does, and she says every year they've lost at least one. And I'm assuming, Kenna, you can unmute yourself if you need to. I'm assuming you've lost at least one doe every year. Do you have any idea to keep some babies alive? So maybe I was wrong. Maybe it's they lose at least one baby every year.
Okay. So that's a hard lightning round because I have 1,000 questions right now. Yeah. so I absolutely think there's a lot of things we could do. I mean, I would, to make this short and sweet, talk to a vet. But step one, I would go through your whole preventative herd schedule. So I would go through your vaccine schedule. Are you vaccinating for chlamydia? I would go through your nutrition. I mean, we would have a whole discussion on starting from the basics of preventative health and going forward.
Thank you. Sarah had a question, and I'm assuming this is for coccidiosis. She was wondering, is there another med that can be given besides Corid? Because she has heard that Corid does not always work, or Corid, I'm not sure how to say it.
Corid, yeah, so Corid's great. So Corid works, gosh, I have seen it work about 95% of the time. If Corid's not working, I would think there might be something else going on. So I'd check another fecal sample and make sure that you're for sure dealing with coccidia.
All right, thank you. Kenna had a question about teeth grinding. She said her 2020 weather did this all the time. I'm wondering if maybe you can address that, or even tell the difference, how they can tell the difference between chewing cud and teeth grinding, because a new member might not know that.
So teeth grinding versus chewing cud. Teeth grinding is literally tooth on tooth in intentional, like their jaws are clenched, they're grinding their teeth. It makes an awful, awful noise. That's going to go along with some behavior changes, maybe wrinkling of the lip. Maybe their lip is kind of a little wrinkled. The edges of their mouth are curled. Their eyes are not going to look very bright. They're going to be kind of dull, maybe kind of droopy. So teeth grinding is not, they don't feel good. Something is wrong with teeth grinding. If they're chewing their cud, they're just hanging out and chewing and chewing and chewing. They'll look at you and chew and do their thing. So chewing cud, they're kind of more alert. They're more with you, but grinding, there is something not right with that.
All right. Lene has asked, can you use fly spray to treat lice?
Fly spray is usually not strong enough and doesn't have the right ingredients. So your main over-the-counter fly sprays are probably not going to be enough to kill lice.
All right. And then we had a bunch of questions about what is common when you were going through a lot of those diseases and conditions. So I'm wondering if maybe you can address what are some of the most common illnesses or issues that you're seeing with our sheep and goats in our area.
Yep. Scours, very common. Okay, bacterial scours in babies is really common. Bloat is super, super common because it's caused by so many different reasons. So bloating, abscesses, the CL abscesses, again, really common. So if I had to go through that list, I'd say my abscesses are common, my bloat's really common. Coccidia, a little bit, that's again a hygiene thing. Lice are actually relatively common, again, a hygiene thing. Mastitis, pretty common. Pink eye happens seasonality wise. So pink eye, I'll get that when my flies are really high. So high levels of flies. So if you can keep the flies down, again, hygiene in your area, you'll keep pink eye down. I honestly, I tried to only pick things that were most common. So for me, I'm like going through my list. I'm like, okay, wounds are really common, right? So bloat's really common. Abscesses are really common. Mastitis is really common. Luckily, ORF is not as common as it used to be. So I think we're doing better at keeping our good hygiene levels with ORF down. Polio, not common at all. Kind of weird to see that if you're feeding good quality feed. Luckily, chlamydia, as bad as it is, I don't see a lot of that anymore. I think we're either vaccinating or doing something right with that. Enterotoxemia, again, only in the babies and not as much because we're vaccinating. So I think we're getting better with that. So the better we're taking care of our environment and keeping our hygiene under control, we're doing better with these things.
Great, thank you. There was a question a little bit lower, but kind of ties into this as something we see commonly. Can you talk a little bit about choke and maybe just in sheep and
Yeah, so that's back to providing a safe environment, okay? So they're only gonna choke on things that they're offered to choke on. So don't feed corn cobs, don't feed apple cores, don't feed big chunks of carrots. So because they are going to bite off more than they can chew, okay? If they're choking on feed, then that's because the feed is too dry or their hydration status is not high enough, okay? So if they're choking on things they're given, like chunks of things, don't give them chunks of things. If they're choking on feed material, then that feed material does not have a high enough moisture content in it.
Okay, great, thank you. David, or I think this is actually, oh, I can't remember her name. But her question was, what is the most common place that you will find ringworm on your animal?
Oh my gosh, I don't know that there is a most common place for it. I've seen it everywhere. I'd say, I don't know why, I've seen it mostly kind of neck front area. So that's kind of where I'd mail, but I have seen it on legs. I've seen it on butts. I've seen it everywhere. But I guess if there's a most common area, I've seen it kind of head neckish area.
All right. Lauren is wondering if general arthritis or even that CAE virus is something that meat goats can get or that they should be concerned about.
Yes. Lightning round.
I know, perfect. Let's see. Jamie mentioned that she heard somewhere that male goats should not have alfalfa because of calcium intake. And she's saying other horse sources say it's safe. Does it matter bucks versus weathers?
Yeah, so I don't feed straight alfalfa. I don't really feed straight alfalfa to anybody anymore. So even my milking guys, because alfalfa just has so much of a high, it's hard on the rumen, particularly there's too much in it for most of them. So I don't really feed straight alfalfa to anybody anymore.
Gotcha. All right. Lauren's asking, this is back to the wraps. Can you use ACE wrap on goats?
I love ACE wraps. Yeah, because you can reuse them and wash them for sure.
All right. Peyton has a question about steers. Peyton, I'm going to go ahead and say hop on our steer one, which is on Monday, January 18th, and ask that question because we're running out of time here. Let's see. I love some of these questions. The goats last year ate the barn paint. Does that mean anything?
Okay, what now?
Her goats, Lene's goats ate the paint off of their barn. Does that mean anything in particular?
That means you have a bored goat. Get it something to play with. Get it a ball to kick around. Get it a block to lick on. Your goat's bored.
All right. Can you give goats baby carrots?
So can you? Yes. Again, be careful that it's not a chokeable type size, right? So make sure that they're not choking on it, that they're chewing. And if they're going to be swallowing versus chewing, then no.
All right, this is a long one, and I think this is going to be our last one here. Let me take a second to read it. Let's see. Okay, so Kenzie is saying, we share a name, yay. Kenzie is saying that my one market wether was eating high quality feed, but still got polio. So we changed his diet and let him reset his system and gave thiamine shots, all with the help of a vet.
Yep.
But then a couple months later, he got it again after he'd been doing good. Is there something we should have changed? We also think he had it since, I'm assuming they bought him, because he had no energy and stuff.
Oh, yeah. Okay. So there goes the one that I had that was eating, should have been a good quality feed, but sometimes there's something wrong within the feed that we don't see. So that one that I had, we had to dig really deep to find out that who knew that inside the sunflower seeds was mold, right? So sometimes things are really weird. So I'm glad you're working with your vet. I'm glad he's on thiamine. Something about if he's still on a better feed, you've changed feeds, he kind of reset things, I'm doing okay. This is a guy that might just need thiamine supplementation, period, forever and ever.
All right. Dr. Gokenauer, I think that is the end of our questions. I did have a question, or I wanted to tell everybody kind of the lineup of the rest of the vet chats that we do have scheduled, so that you guys can have it in the save the dates, because you guys haven't gotten the save the dates yet, because we were still getting some of our other species lined out. So before we log off, you guys, first of all, Dr. Gokenauer, would you mind if you would you be willing to pass on this PowerPoint and I can send it out to all these participants
For sure.
tonight or tomorrow morning? Perfect. So you guys, I will make sure to send this out to you. She's being wonderful and sharing it with us so you guys can refer to it as you guys are getting your project animals, or if you have them already. If you guys would like to join us for when we have Dr. Gokenauer with us, she is doing our vet chats for beef and swine. So whether you have those projects, whether you just loved how engaging she was and you want to join us, we are sticking with Mondays. So beef will be our next one with Dr. Gokenauer, and that is Monday, January 18th at 6 p.m. And then she will be teaching us on swine on Monday, February 1st at 6 p.m. So definitely save those dates. I'll send you guys those dates in an email as well. With the follow-up after this, you'll get it to the email you guys registered for this on. And then in case you have some other species, we do have some other vets lined up to help with us. We are going to be doing a vet chat on rabbits on Wednesday, January 13th at 6 p.m. And then we have a vet chat for our horse members on Tuesday, January 19th at 7 p.m. And then we do have poultry and our dog and cat coming up too, but we're still setting those dates. So hang on for that. This was, Morgan, this was the only one we were doing for goats for our vet chats out of Adams County. So hopefully you got a lot out of this, and there might be other opportunities coming up, but this is what we had planned for this series. So Dr. Gokenauer, I don't know if you can see, you guys, you got a lot of questions on time and place. I will make sure I send those all out in the email because I went through those pretty fast. But there's a lot of thank yous coming through on the chat. If you guys want to unmute and thank her, she did a wonderful job and we're so excited to have her for 2 more sessions. So thank you very, very much.
You are very, very welcome. Okay, so shameless plug, right? So Living Springs Veterinary Care in Bennett, Colorado. Get your pen and paper ready. I am going to give you my personal email address, which I don't do. So I'll let you guys in on a little secret. It's Living Springs, S-P-R-I-N-G-S, vet, V-E-T, care, C-A-R-E, at E as in elephant, S as in Sam, R as in Robert, T as in Thomas, A as in Apple.com. So if you got some really good questions and you want to hit me up, I'll be here for you. I am here for you.
That's awesome. Thank you so much. Would you mind if I put that in the email out to kids after the fact?
Yeah, that's cool.
Okay, perfect. So Morgan, I'll put that in the email as well, the follow-up email, probably tomorrow morning. Again, thank you guys. We had kids from all over the state. So if you enjoyed this, please share it with your other members, share it with your leaders so that other kids can take advantage of it and other families. So with that, I think we are going to log off for the night and watch for that follow-up email tomorrow for the resources and those other dates that we have set for this Vet Chat series. So thank you all. We're going to pop you off. Dr. Gokenauer, thank you so much for donating your time this evening and all your expertise.
My pleasure. I had a ball. I wish I could see you guys.
Yes, we will see you in 2 weeks then.
Cool beans.
All right. Bye, everybody.